Hi, I'm Dr. Rainer Fischer. I'm a naturopathic physician in Scottsdale, Arizona. A naturopathic physician is a doctor who specializes in natural medicine. In this video, I want to give you a quick overview over currently available treatment options for chronic joint pain. The most common causes for chronic joint pain are arthritis and degenerative joint disease. What is arthritis? I'm talking about osteoarthritis. It is a chronic inflammation in your joints. And you may know chronic inflammation can cause damage. In this case, cartilage damage and joint damage. And the result may be a cartilage wear down, a breakdown of your cartilage, and your joint space becomes thinner and thinner. What am I talking about? Joint space, that's the space in between the two bones of a joint. There is a cartilage in between that is supposed to cushion that area and make the joint functional. And if you have that low-grade chronic inflammation there, it will cause a breakdown of that cartilage, and that space in between will become thinner, and you can see that on an X-ray. What's the result of that? Well, we have chronic pain. We have a joint that becomes more and more unstable, which may cause even more damage. You have even more pain. You have stiffness. You have bone spurs and many other things. So that's why you want to treat that, prevent it, and treat it in a way that it does not interfere with your life quality and mobility. What causes it? Well, we don't know. What we know is there are contributing factors. One factor is a pro-inflammatory diet. So if you eat a lot of sugar, a lot of refined carbohydrates, if you're missing out on vitamins, on vegetables, on antioxidants, well, that all can fuel the inflammation. Another cause may be obesity. If there's a lot of weight pushing down on the cartilage, it may wear down sooner than later, and so cause more damage. Or you're doing repetitive motions that are not good for your that are really hard on your joints. Another reason why you may have arthritis resulting from that. But there are even patients who don't have any of those factors. They eat right, they are not obese, they exercise, they do everything right, but they still have arthritis. So that is why we say, well, it is a condition of aging. It comes with age, so especially in the second half of life. So what can we do about chronic inflammation, about arthritis and joint degeneration? Well, we want to prevent it. We want to keep it. We want to keep it from getting worse and worse, and we want to treat the pain that is already present. What can we do? We can use beginning with exercise. Right? Exercise strengthens the muscles of the joint. Joints become more stable. The circulation is better. You are more motivated to exercise more. You're losing weight, and everything together may help you with pain. Yeah? Another option that you may do in the beginning, maybe wearing a knee brace. A knee brace. Now you put it on and it stabilizes the joint, and it may deflect some of the forces that are applied to the joint so that it hurts less. If you're one of the lucky ones that find a brace that works for you, use it. I think it's a good option to do it if you find one. There's a lot of braces out there and they don't work for every pain. Every patient has a slightly different pain in slightly different areas. I have some patients who use maybe 2 or 3 different braces. They seem to know what pain day it is in the morning, and they decide on a specific brace, and that's what they wear and all day, and it works for them. So if you're one of the lucky ones, go ahead and do that. Another big group of treatments that you may try in the beginning is the big group of supplements. I'm talking about fish oil, turmeric, chondroitin, glucosamine, all those things. They certainly can be helpful. I'm, as a naturopathic physician, I certainly value those options high, but I also know you have to use the right supplement, the right dosage. It has to be a reputable source from a good company. Then you will have good results. So I really recommend talking to a physician like me, a naturopathic physician that can help you find the right options for you. So now, let's say you tried all those things, they work to a certain degree, but it's still hurting. What you're gonna do? You go to maybe your primary care physician. He recommends or she recommends you a cream, maybe lidocaine, maybe anti-inflammatory medication. You put it on, it suppresses the pain, it helps with the inflammation, and patients do that for years and years and are happy with that solution. Another option, anti-inflammatory medications that you take as a pill. There are a lot of options out there, over-the-counter or prescription, ibuprofen, naproxen, or Celebrex, another commonly used anti-inflammatory prescription drug for arthritis pain. Well, you know, everything you take long-term, there's always the risk of side effects. It may be upset stomach. It may be even stomach ulcers. It may be a higher risk of stroke or other cardiovascular problems. So not everybody likes the idea of taking medications long-term. But in some cases, this is what you have to do if there is another option available. What else do we have? Well, if I think about medications, there's still another option. You can step it up and take, have been prescribed and get prescribed a narcotic medication. Well, they certainly work, but they have a side effect potential that you may not like, especially considering the recent discussions about opioids. So there is the risk of dependence, there is the risk of abuse, and a lot of patients they just said that I've tried it, they work, but I just don't like how they make me feel. And so this is certainly a strong medication that is not for everybody. So after that, what else do we have? We have those type of injections that are often called gel shots. It's a type of viscous supplementation, meaning you're getting an injection into a joint, you'll be injecting a viscous substance, a substance that acts as a cushion. It kind of helps support the cartilage. If this cartilage is very thin, we have some additional cushioning in there, and that may help for some patients. For some it works more, for some it doesn't work that well. It really depends on the individual case. But it is really something I would think rather benign. It doesn't really hurt the joint or anything. It just helps cushion it for a while. It's temporary. It's not a long-term fix, but it does help to a certain degree. If that is not what works well for you, your doctor may say, well, let's try a steroid injection. Steroids are very powerful medications. They can suppress or block inflammation very effectively. There is just a problem with that. Inflammation is the first step of healing. If you block inflammation, pain certainly goes down, but there is no healing happening. There is no repair happening. That explains why if you use a steroid injection, you will end up with a worse joint than before, and studies have clearly shown that you give half of the patients just this saltwater injection, the other half gets a steroid injection. Well, the ones with the steroid injection certainly have better pain control, but at the end of the trial, the ones with the steroid injection had actually a breakdown of the cartilage that was worse than the one with the saline. So it's even worse than doing nothing when you do a steroid injection. So that is why I really would not recommend using steroid injections. Also consider the side effects, elevated blood sugar, immune suppression, weight gain, and many other things. So you may not want to do that if you not have to do it. So what else is left? Well, we have now surgery. Surgery is the option that I would call the point of no return. Meaning once you've done that, there is no way back. Once the joint is replaced, it is replaced. You can't go back. It certainly works, but there are also considerable side effects to consider. You have a really long recovery time and a downtime. There is rehab necessary. You have the risk of surgery with all the infection and things like that. You have the risk of general anesthesia. And it doesn't work for everybody. Sometimes you need a revision surgery to fix the problems of the first surgery. So it is certainly a very invasive procedure that is not for everybody. So what I often show my patients is that picture. I don't know if you can see it well. Yeah. So what you have here is what I call a treatment gap. So you have all those conservative treatments here, medications, pills, steroid shots, supplements, and so forth. And on the other hand, you have surgery that is the point of no return. So it's understandable that you don't want to make that jump here or as late as possible. Because there is no way back. So doctors will prescribe medications, will do steroid shots on and on, up until you will say, I can't do it anymore. What can we do? Well, your doctor will say, surgery. And you jump over here and you do it. Right? So there is really a treatment gap here. Wouldn't it be great if you could just walk over here slowly? Walk over here and maybe never arrive on that other side. Right? So now with stem cell therapy and regenerative medicine, there is that option available. So it really can help you move over here much slower, stay longer on that bridge, and maybe you never need to cross over fully. Maybe you never need to do surgery, or if you need to do it, you have to do it much. You need to do it much later on. So that is an option that is available. Okay, I don't want to talk about that more because I have more videos about that. For now, that's all I wanted to say about stem cell therapy. I hope this quick overview can help you make better decisions for your chronic joint pain. If you want to come to my website, I have more information about that, some answers to common questions, and you can even there's another video about stem cell therapy that goes into that in more detail. And you can also make an appointment with me. I can talk to you about your options, and it may help you make an informed decision.